Amazing. Okay, so it's a small group, so this will be super easy for us today. We are live as well, so if there's any questions, more than likely you'll get them answered. My name is Kayla Corbett. I'm the founder of the Operation Childcare Project. I've been doing this work for a really long time, for a while through Operation Childcare, which is my other company, and now over into the 501c3. I created this company after quite a few situations. Myself as a military spouse, where I realized what little attention childcare was getting and what the actual impact of that was. I noticed this when we moved to our first duty station together, which happened to be overseas, and the only spouses that I saw working were those who didn't have children or their children were much older, and it was like a slap in the face. Like, you knew immediately what was happening. I happen to have a background in contracts, and so I spent the next few years volunteering and helping families navigate what that subsidy process looks like, so they kind of know what to expect, how to do the paperwork, things like that. And it wasn't until we got back to the US, and at that point I was an expert in it. I'd helped many, many families. And I went to a center that was on the list that I was approved for. I had my job. And then I found out 2 months in that the center should have never been listed as approved. And I ended up being out, it was about $7,000. And at that point, there wasn't any ability for me to get on a different wait list for childcare and keep my job. So I quit. And it took another 1.5 years before I was able to actually get another job. And so what I realized is that if I, as a subject matter expert, could not do this, how in the world are other families going to be doing this? So I took that opportunity to kind of do it myself. Kind of like that, fine, I'll do it myself mentality. And I will say, I still frequently lose access to childcare fee assistance, even though I am an expert in this. It's a kind of a lack of transparency, which is something we'll touch on later. It's policy, it's exhausting, and what I found is that most families just give up. They don't try anymore, which is really unfortunate, because if we were louder about it, we would be more likely to get some sort of policy change. But you're really made to think, this is a moral failing. Like the opportunity was there, a solution is there, and you just haven't tried hard enough, or you did it wrong, or you're expecting too much. And so the louder we are about our collective experiences, about how it's almost like it's stacked against us, the more likely we are to be able to really impact change. Which is why I'm so glad I have an entire panel here with me, everyone experts in various aspects of what they do, and I'm gonna let them do their full introductions and really just talk for a few minutes on what they are subject matter experts in. Everyone on this panel has a military affiliation, so everyone has been in it themselves, and I think that makes a really big difference when we talk about what policy should look like or what programming should look like, because when you've lived it, you have a better idea of what the impact would be. And so we have Heather Campbell, and she is a subject matter expert in food insecurity. She's a registered dietitian, and she's also the chair of the advisory board for Operation Childcare Project. And then we have Maria Quinn, and Maria is on my board as well. She handles military family experience, and she owns a company called Design Your Family Life. And then we have Jennifer Bittner there at the end. She is the executive director and the lead researcher for Exceptional Families of the Military. One thing that's not touched on nearly enough is how our EFMP families don't even try to access childcare anymore. They really have to focus on keeping their children alive. So childcare access isn't even something that they could begin to touch on. And then once you start looking at the policies for them in particular, it would take a mountain to be able to get that. So I'm really grateful for her and for Exceptional Families in the Military for lending their expertise so we can design programs that make the most sense. So I am going to pass over to Heather first. Heather.
Hello, yes, hello everyone. Again, my name's Heather Campbell. I am a registered dietitian in pediatric and family nutrition, now turned into an accidental advocate. I borrowed that phrase from a friend of mine, and it basically means I didn't plan on being the voice or the face of this issue. But turns out, as many of us have seen, when something affects you and it affects your family and you get angry enough and you start digging for research, you kind of become an expert in it. And what I work in is in food insecurity, and specifically some of the systemic shortcomings. Now, it's important, right, because we're data nerds up here, you've got a bunch of nerds. You have to define your terms in the beginning of a conversation. So what is food insecurity? Food insecurity, according to the U.S. Department of Agriculture, is a lack of consistent access to enough food for every person in your household to live a healthy and active lifestyle. Food insecurity is not hunger. Hunger is a physiological condition, right? It's in your body when you are not getting enough. Food insecurity does not mean that you are not getting enough. It means that you are consistently facing a socioeconomic status where you cannot get what you need reliably. That is a huge mental burden, something that military families are already facing. Mental burdens in PCSing, in employment, in childcare. And when we're looking at this, we see it's not hunger, it's a socioeconomic status, it's stressful. And this is something that's been researched over the last couple of years, but it's not a new problem. This problem has been around for a long time, but data talks, right? So now we have organizations like Military Family Advisory Network, Blue Star Families, National Military Family Association, Maison. We have really amazing organizations who are starting to take a look at this. And the most recent data that we have from the Department of Defense, they finally sort of said, okay, we'll look. Okay, so they look, and their number is 1 in 4 military families are facing this. So there's very clearly a systemic component. And it's, again, like I said, it's not a new problem, but it's something that's newly being discussed. So why is this? We know if it's happening this often, it's happening this recurring over years and years. This is not just poor financial practices for families. This isn't buying cars they can't afford. This isn't, having lots of debt. Although those things do impact the financial status of some families, that is not what we're seeing in the bell curve of these families, right, when you're looking at data. So MFAN, the Military Family Advisory Network, came out with research back in June of 2022. They did a bunch of research over 2020 and 2021, and they have causal factors. And what they came out with, I wrote them down because I always remember 4 and not all 6. So I wrote them down. The 4 I always remember because of my story. Loss of spousal income, growing your family, a recent PCS, having an unexpected expense. Military families don't have the savings to absorb an unexpected financial burden. An external system shock like a hurricane or ice, or moving somewhere far away like Arctic Alaska, and also the rising cost of living. And what they found is if you've experienced one of those things in the last 12 months, you are more likely to experience food insecurity. Now, when I heard this data, I was sitting in the data release, I was in the Zoom, and thank God I had my camera off because I wept. Because in our season of food insecurity, I believed that everything was really hard because we must be doing something wrong. Before I became a dietitian, I have a background in personal finance. I know budgeting. I'm a family and pediatric nutrition expert. I know how to feed my family. And we still couldn't quite make the math. It wasn't mathing, right? Like, what are we missing? What am I doing wrong? There's this burden on my family, and it's because I'm not working and because money is tight, and the burden on my family is me. And my family would be better if I wasn't in it, right? There's this very real spiral that happens when you have loss of income, when you have loss of support, when you have loss of what feels like identity and purpose. And so listening to these causal factors and looking at them, I kind of revisited that season and thought, where am I? When this was happening to us, you guys, we had 5 of the 6 causal factors. And it was just such a validating moment to realize it wasn't us. We weren't doing something wrong. This is now studied, it's documented. And it's important to know that there's a study that just came out this week, actually, in a journal of BMC Health, that there is a 250% risk increase of anxiety and depression among families facing food insecurity. So we cannot talk about things like food insecurity and these systemic shortcomings without talking about how they relate to one another. And with each of these, spousal income, growing your family, a PCS, unexpected expense, a system shock, or the rising cost of living, each one of these are going to relate back to our lack of access to affordable and accessible childcare.
Yeah. Thank you.
You're welcome.
I love it. I love it when other people get it. And honestly, what we do know is that from the same studies is that less than 30% of military families are even able to access military fee assistance. So it really is a very large portion of us that are in need of this. Does anyone have any questions for Heather specifically before we hear from another expert. No, and I can't read that down there, but I have one that someone had submitted ahead of time, so great news. Heather, could you tell us about whether an increase in pay would help? Would that solve the issue?
So it can. So every family that's going through a food insecurity season, it's for different reasons, right? We have these causal factors, and you have to realize that food insecurity, not being able to put food on the table, is a symptom of other problems, right? So food insecurity in and of itself is not the problem we need to solve. It's these other causal factors that are putting families in this economic status. So for some families, yeah, a pay change in military families and military income might be the solution that they need if they have a family structure where they're requiring a caregiver like our EFMP families or families OCONUS, right? We might see that really is the breaking point. We know that 2/3 of Americans agree that we need 2 incomes to function adequately in American society, yet military families and military spouses struggle with unemployment at 6 times the national average. So getting that pay increase could help. And there's a lot of systemic things that we won't talk about in today's panel, but that is one way that it might help for some families.
So would you say that the somewhere between what, like 1.5 and 3% would make the difference?
I cannot say that I think 1.5 to 3% increase would make the difference, although for some families it might.
Yeah.
We lived overseas where we received COLA. We had a cost of living adjustment. And where we were, the index, right? You guys can, if you want to be a data nerd, you can go in and find all these indexes and the indices and how they determine them. And it was 134 where I lived. Well, when you actually break down the pay and you see where they apply that COLA adjustment, for my household, it was about a 16 to 17% raise. Did it help? Absolutely. Did it close the gap of the lack of income versus the cost of living? It didn't. And for my family, that meant dipping into savings, dipping into second income. But there's a lot of families, especially in the military community, who can't stand in that gap for themselves of that extra cost of living. And we were lucky because we were overseas and got cost of living adjustment. Our families in Southern California and on the East Coast, in Manhattan, and some of these more expensive areas, Tampa, they're not getting that. So they're seeing the same struggle, and they're not even getting that 16 to 17% adjustment.
Yeah. Okay, thank you. Maria.
Yes, ma'am.
Oh, yeah, go ahead.
So remove the childcare portion of this, and let's say that you have an EFMP family, right? And your children are on the far side of the spectrum to the point that they can't be in school, they need to be homeschooled, they need that extra care, that ABA care, which is really a tough subject right now, and I know we're gonna get into that. But what would be the next step in order to help with food insecurities?
So I think if we are able to have access to childcare and we're able to get all of the families what they need to support, childcare to support so that spouses can have employment or can even just have opportunities to fill their basic care tasks for their family, right? I'm sorry, going to the grocery store alone is not a break. It's a care task for my family, right? We call running errands chores outside the home. So letting me do my chores by myself is not a break. You're not doing me a favor, right?
Mm-hmm.
So
That's a good way to word it. Honestly,
it's just chores outside of the home. So, for some of these families, maybe it's not because they need to have a second income, but for sanity's sake and therefore the mental safety of the caregivers and the parents and the family, it is important that we have opportunities to get the support that we need. So while childcare might help, in some families it might allow income for a second job. It might allow volunteering, giving back to our communities, being involved. There's lots of different things that sometimes we're kept from because we don't have a way to partake in those activities when we have children.
And I think the EFMP portion of it, a lot of people will be like, oh, just apply for respite. It is not that easy. We qualify for respite. We cannot access it though, for multiple reasons, whether it's not enough providers, there's not enough hours, et cetera, et cetera. I am fortunate enough to be an EFMP family where I can work part-time from home. But even if I did access respite, which a lot of people tell us, hey, if you want childcare, apply for respite. We can't work. It's in the regs that you can't work. So what if you're active duty military? And I'm dipping into what I was going to introduce, but why not? Whatever. Just go with it. Anyways, so we have active duty family members that come or dual military families that come to us at EFM and say, hey, what can we do? My child, I just had a baby and they're in the NICU, they're going to require nursing care. What they're telling me, I can't go back to work, and what do I do? And not sometimes they have to get out. You know, one spouse has to get out of the military. Let's be honest, it's usually the wife, right? And sorry, Facebook. But anyways, but it's typically you know, the mother that gets out, and you know, whatever. But it's just sad that we can't work or go to school. So even if you're trying to maybe go get your undergrad or go to grad school, we can't do anything. It's used to just rest. And I believe some of our families have been like, to take a nap. I've been told by somebody in leadership, like, you know, just take a break in the closet. Just sit in the closet and like eat something. And I'm like, that sounds fantastic. Like, I used to be a previously practicing therapist. I'm like, that was never on my list of coping skills. But you know, so it's things like that our families are legitimately being told. And when I tell you, when I got that like advice as respite, I was just like, every time I go in my closet now, I like look at it. I look at it differently. I'm like, this is not
Time for your break.
Yeah, exactly. Right. This is my time out.
I think about it with like pre-puberty kids, right? We're in those tween ages, and like I have boys, and they are starting to really stink. It turns out that like boys are stinky, you know, and their shoes smell terrible. Like I don't want to go sit in a closet with their sneakers because I'm not going to eat a snack in there because it smells like hot feet.
And I mean, think about it. You know, we're all moms, we're all caregivers, and you're going to sit in your closet and you're like, God, I really need to organize this. I need to get rid of this. We're going to be PCSing soon. This needs to go. It's not going to be a break. Anyways, sorry. Yeah.
So, for those the 1 in 4 families that are experiencing food insecurity, whether they even know what that is what they're experiencing, right? Because they may have all of these issues at the same time. What type of education or things that are out there for them if they don't know, even they're in this, they don't know how to label it, you know, it's okay, this is what we're experiencing and we feel bad and is it our fault or, you know, whatever.
Yeah, no, that's really fair. I'm going to let her answer the food insecurity, but I will say when I speak to families, and this is part of one of the reasons why I talk about restructuring of surveys, because a lot of the ways that they ask the questions, they're not getting to the core issue. Was a PCS a cause of stress in your life? Yes, but why? Why was it a cause of stress? Why did it impact your employment? Was it because frequently what we'll end up finding out is they had childcare, they had a support system, they had a family member nearby, they had a job, they had everything laid out for them, and then when they moved to the new location, maybe they only had one of those pieces, or they only had 2 of those pieces. And what we're getting to is the actual core issues. And when it comes to food insecurity, like you said, in the 5 causal factors, when I read that report, 6, sorry, you're right, look, I just did it. When
you internalize the ones that make sense to you, right? Like, oh, these are mine, yeah.
When I read the report, I was so excited that the attention was finally being brought. And so even when they did move from the first piece being like the child aspect, even when they went to the second piece and they got the quotes from the families, it was still, well, I didn't have childcare, so, and I was like, yes. Not for them, of course, but like for the cause. Yes.
Like vindication.
I think when we're, thinking about food insecurity and not knowing where the pain point is, right? Like, is it like, oh, is this all related to because we moved and I lost my support network and I can't get work that covers childcare, and that's where there's a problem, right? Because in that season of stress and overwhelm and that mental load, you just know that it's not working and you're not sure which piece. I think that from both our military side and the services that we see in our military branches, but then also from our caregiver side, I've been working with our DOD and our, just all of the healthcare providers as a systemic level, been working with the commissary and working with leaders, and even on the civilian side to say, hey, we can't look at these things as separate topics. We can't look at the lack of spousal employment without talking about childcare. Hey, you're having a hard time putting food on the table. Well, here's some food to get you by, but also let's figure out where this problem is coming from, right? And that comes from having really uncomfortable, honest conversations. But more than that, having standard operating procedures so that ideally we get this 24% way down, but also knowing we're going to continue to move, we're going to continue to have loss of spousal employment, we're going to continue to have these things. So how do we have standard operating procedures so that when we're screening somebody after in process at finance and they're submitting their vouchers, we're saying, are any of these things where you need assistance? Spousal employment, childcare, blah, 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 right down this list, where we know that all of these things are interconnected. We have the data. So let's start having these conversations together, having these conversations at child care visits, at our well babies and our well child visits, having them at our postpartum appointments, having them at our mental health appointments, having them in finance, having them in the spousal, the employment support. When we really start having these conversations as a whole, it's going to create a web where we're working in collaboration for the good of military families instead of siloing off conversations and thinking we'll solve one thing at a time.
Yeah, Heather, I want to add to being able to ask these questions in mental health checkups, PCM checkups. I don't know, especially at, again, military treatment facilities when we've been treated there, I'm training the people who are asking the questions to ask it in the appropriate tone. I can't tell you, as being a previously practicing therapist, I'm also a psychology professor. I can't tell you how many times I have told doctors or nurses or something, the way you're asking me these questions does not make me, if I was experiencing these things, does not make me want to open up whatsoever. It's you're not gonna hurt yourself, are you?
Literally the tone.
Yes.
Literally the tone.
And I'm just,
No.
in my head, I'm just seething, or, being open about it's okay if you are. It's the same thing in the civilian. We're in a remote location right now, and it's the same thing. It's oh, please don't say yes, because I don't want to address it.
Right.
But training these people, training these workers to make families comfortable coming forward, because also being EFMP, we get a lot of families touching on food insecurity that are food insecure for reasons that are not the same as non-EFMP families.
Right.
We have dietary restrictions for a lot of our, if you have any sort of food allergy or anything, you get a lot of families. Yeah, we have, Heather, you're gonna know more about, I'm just, anyways.
No, but it's true, it's a good thing to bring in.
But we had a lot of, I tried to seek help. I have our previous survey report here, and it's I tried to seek help, but we have a lot of food allergies, and food banks and all these food pantries and stuff don't have the items that I need for, I have celiac disease personally. I'm not an EFMP, which somebody is probably going to see this and then tackle me. But they haven't told me yet. But anyways, I have a gluten allergy, the legitimate gluten allergy. It makes me sick, and if I had to go to a food bank, 9 times out of 10, they're probably not going to have any of the items that I need. My daughter has a severe egg allergy, EpiPen wise and stuff, and everything contains eggs or egg whites. So, also too, to flip it with the food insecure, our families are being admitted to hospitals or driving long distances for these appointments and stuff, and on top of childcare issues because of having barely any access to caregivers at times, that is really difficult, and that's definitely a piece. We have to pay for parking. We have to pay for parking fees at hospitals. If the EFMP family member is an adult and they're admitted to the hospital, if one of their children is suddenly admitted to the hospital, think about how the cost of food at hospitals. I'm going to tell you right now, it's no different than Vegas, because it happened to us last August, because my daughter was suddenly admitted very late in the night, and just thinking about that, okay, my husband couldn't bring me any my food up or anything, and so it's things like that our families are constantly having to budget for. Austin often tells the story of the family member that's trying to decide, am I paying for gas or food at the hospital, or am I going to buy or a medication or something, or am I going to buy a gallon of milk? We've literally had to make that decision. And if we did have more access to childcare options besides respite, because the CDCs don't take our kids that are medically complex. They take kids with ADHD and limited behavioral issues, but they're not taking my severely autistic son,
Right.
who is non-speaking and uses an AAC device. They probably don't want my daughter, who has like 3 different inhalers and an EpiPen and all. They could tell me that they would, but it would be very dicey. That'd be a really big, gamble on our end. So it's such a cyclical,
It
if I'm
is.
using that word correctly,
Right.
concept. So sorry.
Perfect
It's
order.
okay.
Yeah,
it is
because
really great.
Apologize.
I'm gonna jump in.
It's all right.
And
I think we've gone rogue. We can
no, this is perfect. This is perfect. So Maria Quinn, everyone. Hello. So what we've kind of laid out is some of the really, really, really tough challenges. And so Maria Quinn, I'm speaking here on behalf of Maria Quinn and Maria Quinn only, not on behalf of the Department of Defense or the Air Force or the Space Force. So we're dual mill. We've been in 15 and a half years. We've got 6 little ones. When we came out to DC in 2014, we were both on 12-hour shifts, different schedules, of course. And we both feel called to serve and also grow our family. And so we had to invest immediately in another adult, right? How else do you show up for work if not another adult? And as all these PCSs, we're not in your family, pretty standard, right?
Mm-hmm.
And so we, for the first time, invested in a nanny. And I do call it an investment because if you've done any numbers, it is a true investment.
Yeah.
And so for the last 12 years, that's what we've been using to ensure that we can serve and do decent. We've done okay, right? My husband's in the audience. Thanks for cheering us on. And again, having 6 kids, so it's been a blast and we love it. And we're hopeful that we can share those experiences, the good and the bad, to really encourage folks that you can do it. You just have to invest, make some serious choices. But really, what I want to share about today is the Childcare in Your Home pilot program. So different solutions for different people, right? Based on what your family is, what your work schedule is. Sometimes the CDC is not the only option. And as we all know, there isn't enough capacity at the CDC if every single one was staffed perfectly, right?
Yeah.
So we owe families more than just the CDC. So what I've been trying the last 2 years as we have this new pilot program is, okay, I think there's a missing piece. And so now that we've hit about 750 families that we've supported with this missing piece of on-demand childcare education support, because what you've just heard from not only their personal experiences, but also every single family they've supported in their individual roles, is that, as I hear all the time, is childcare is personal. Absolutely, right? As a parent, that is our obligation and opportunity to figure out what's best for us, right? To figure out our long-term family goals and get after it in the short term. And so being able to help families know that they have a full suite of options is what I've kind of been testing. If I can come in these crisis situations, which a lot of times they are crisis, and it's leaders and families that have called me in my test pilot the last 2 years, I tell them I'm going to take you from feeling overwhelmed to back focus on the mission because your family is secure. And the security that I'm working on is the child care piece. And it's the education. Sometimes we only know what our parents did for us, right? Mom stayed home, maybe dad stayed home, maybe grandma watched, or maybe you went to daycare. And maybe that's all you realize. And so for a lot of our folks at every single rank and in every single branch, there isn't a common understanding of the full suite of childcare options. And so that's what I'm trying to bring to the table is we now know more than ever across America and in the DoD that we have more single working parents because they have to, right? And we have more dual working parents than ever before. And so what does that mean? Does it mean childcare is an option, a nice to have, just like Kayla eloquently pitched earlier today, so proud of her? Absolutely not, right? Childcare is infrastructure. It is the very basis for us to be able to get after these harder things. And so learning how to change that conversation and meet families where they're at to be able to help them understand, okay, here's your options, let me explain them to you. Here's your fee assistance options. I want to make sure we bring that into the conversation. And so education side, I give them the options. I make a recommendation. I have this 6-foot Visio that I've done because I really want to automate it. I want to help more families. Kind of this choose your own adventure. Like, how are you going to serve your family best and reach those goals? And then they make a choice, and then we enter into the support phase. And then I stick with them from A to Z, whether it's from, I'm just so privileged to have these phone calls. Some of the calls are, a dual mill family or dual working family we want to have kids, we are just too darn scared. We cannot figure out childcare. Let's talk about it. Like, let's get some strategies in place before we even get into that so we can make sure you are not just scared. Some of them are PCSs. Oh shoot, so Space Force, right? Going to Colorado Springs. Anybody knows this, Colorado Springs is pretty tough right now for childcare. All across the area, but we're really focused on childcare in Colorado Springs in those wait lists. So what are you gonna do? If the CDC is your #1 choice, that's great. What are you gonna do in the meantime? How am I going to make sure that you can get to school and get to where you need to go? And then sometimes it's, hey, a nanny actually makes sense, or a nanny share, or an au pair. And I really, really want families to be able to make those choices the first time, so they're not rematching with multiple au pairs or hiring inappropriately. So what I've done the last few years, I'll be fully honest, have not made a penny, and that's perfect for us. I really want to be above reproach as I'm navigating the active duty side and the where's this missing piece that I really want the DoD to invest in. And so that's exactly what it is.
Yeah.
On-demand education support.
Yeah, and I met Maria through that work.
Yeah.
Yeah, because we both were like, they just need to know. People just need to know. Sometimes you need to know that there is no option. Like sometimes you need to know that what you think is going to be it is not it. And that's,
I mean, sometimes the policies on paper don't work like they're designed to work.
don't be ridiculous.
Yes.
It's just a very, and if you've seen like any of my posts, it is resource gaslighting. It is saying, well, just go to the CDC. Well, the CDC is not an option. It's not available, or it doesn't fit our family's needs, because military families do not have traditional care schedules. We need before 6 a.m., after 6 p.m.
Yeah.
We need overnight. We need multiple days sometimes. Sometimes at the drop of a hat, you need someone. And that is what is not being filled. And that's why I love Maria's work so much, because she is recognizing that, she's working on it, and she's like, I can give those skills, I can give that education, I can give that support them so that they feel like they can do it.
Yeah, my biggest thing is I just never want them to feel alone. And I've shared this before, you know, even navigating this new fee assistance, which is a huge deal. For the first time ever, we have a fee assistance for nannies. It's called the Childcare in Your Home pilot program. And even there's been times when I felt alone, and I'm the most experienced with this program, and so you just realize, sometimes it feels like it's stacked against me. So I'm committed to, now that you've heard the problems, I'm committed to how are we solving the problems at bay, and so this is what we've been demoing the last 2 years.
Wonderful. Love it. And you can follow her on anything and everything. I highly recommend. And we already heard from Jennifer, but
You got some more?
We got
if you want to really quick before we go to action items, like if you want to share some data, I know you have some pretty amazing data.
Yeah, so I'm the executive director and lead researcher for EFM, and it's just really kind of, because as everybody's talking in my head, I'm thinking, I'm like translating it to EFMP lifestyle. I'll start with what brought me to EFM. I have 3 kids who are all enrolled in EFMP. Now, when I started volunteering with EFM, not all 3 of my children were enrolled, just 2. And what actually was not a childcare issue or anything else outside of what brought me to EFM, it was actually I had 2 kids enrolled in the Autism Care Demonstration, which is called the ACD for short, and now only one of my children is like semi-enrolled, I guess. But anyways, I had questions about it because they made serious changes in March of 2021. It's been very difficult for families, but I don't want to say fun fact because I'm actually I'm pretty bitter about this, but my kids were enrolled into a demonstration / it's also, which is fancy talk for saying a pilot study without my knowledge. So not one person ever told me from 2017 to 2021 that my child was enrolled in a pilot program, that they were collecting data on my children without my knowledge. The developmental pediatrician knew. PCM, everybody involved, care managers, Tricare, everybody, not one person told me. So I came to EFM wondering about these changes, why these changes were being made, who was deciding them, and had to talk with Austin and other people at EFM saying this is, in my opinion, as a researcher, this is wrong. So that was that, but that's what brought me to EFM, and at first I was just gonna be like a little baby volunteer when I could, and now here I am because Austin's very convincing if you know her, and so is Rebecca, and so anyway, so this is why I'm here today, but also too, as we were talking about, like I have had childcare issues. I've had an issue with, my son is considered severe on the spectrum, non-speaking, again, has an AAC device, and when he was little, we had issues with childcare. I was working part-time in-person teaching at the community college at Fort Liberty, and or what's Fort Liberty now, and there was a point where my kids' daycare told me, they're like, we can no longer help him. You have to find care elsewhere. And I had tried to apply for assistance and fee, for full-time daycare. I was not able to do it. Childcare told me, oh, sorry to throw you on the bus, but it told me you don't qualify, everything. So it's very difficult. And again, I have been through the whole, even now still, my kid is in school, it's still very hard to find that respite or the caregivers that that want to work with my son. Because we have been, as being an EFMP family, I have been in a situation where my daughter was admitted to the hospital very late at night, and she was 3 years old, barely 3 years old, and had to ride an ambulance by herself because we had nobody else at home with our other 2 kids, so my husband can come get my car. And I can tell you that probably traumatized her more than me. She probably thought it was a great time because she got toys, but you know, it's things like that that our families desperately need, and how we also got tied into Kayla. We hear that my story is not unique. It is not even the most drastic story out there that we have heard at EFM, but we strive to help and advocate for our EFMP families, because at the end of the day, I hate to say this, we are not considered when policies and regulations are created. We are an afterthought. It takes us to come to the table, or to not even come to the table, but to bust down these doors to be heard. And I mean, I obviously could go on and on about it, but it's not fair,
Right.
that we aren't considered in a lot of these decisions that are being made.
I think that's what I want to focus on too, is, you know, where do we go from here?
Yeah, absolutely. And so I want to run through our action items. So what we want, each one of us wants you to take something away from this. And then if there's time left at the end, I do want to take any other questions that you have based on what we said, because we have said a lot. My action item is, I want everyone to demand transparency and accountability. If there is a program that is serving military families, if it's a program that is taking grants, funding, anything of the sort for military families, demand transparency. Demand to know what funding is going towards administration, what's going towards salaries, what's going towards the actual families themselves. Because there are many organizations who have a significant amount of funding, and we're not getting at the problem.
Yeah.
So we want to support organizations that have that transparency, that say right up front, you know, 30% went to this much goes to each family. Because at the end of the day, if it's not serving the family in a meaningful way, if you could just give that money to the family instead and have a greater impact, then perhaps the organization is not one that you need to be advocating for. We want organizations making not only systemic change, but also change right now. So demand accountability, demand transparency, and use your voice accordingly.
I think for me, you know, when we're thinking about food insecurity, which like I said is a symptom of other big like systemic issues, you know, the big action piece would be, one, educating yourself on different things, different gaps, different areas of concern for military families, or even for your local community. Some of the things I've experienced in military community, you know, on the East Coast are not the same needs that we had in interior Alaska, right? So understanding really, when you have these uncomfortable conversations, either within your family or within your community or your installation, where are the gaps and how can we stand in those gaps? Because the reality is, many of us know, policy change takes 5 to 7 years if you get on a fast track, right?
Right.
So we're talking about really long timelines for systemic change. So we need to understand where the gaps are, so that on our installations and in our local communities, we can be standing in the gaps for those families. Is that food pantries? Is that nonprofits who are holding childcare? Is that, you know, what does that look like for each family's need, and how can we stand in the gap for what they need while we wait for those long-term changes?
Absolutely.
Mine would be, when you're making decisions, whether it's on boards or policies, or really considering anything that's going to impact military families, ensure you have someone that is currently experiencing that at the table.
Right.
So if it's childcare, have someone like me, I'd love to go anywhere that you want me to represent families and say, have you considered it from this perspective? Because what we're seeing is that, you know, in a bureaucracy, which the DoD is, we're not really accountable to shareholders or the bottom line, and so unfortunately families are missing their voice there. So consider having the folks that are impacted by it as a part of the conversation, and that can be done in many different ways, but do not continue to exclude folks and look for opportunities when you can have them there, even if it's maybe extra. You think it's extra. I bet a military spouse or someone that's currently experiencing the problem could really help bring some new ideas and absolutely a fresh perspective to make sure we can make some change now.
Yeah, absolutely. And Jen?
I agree with Maria. Austin and I have talked about this and several others at EFM. Bring EFMP families to the table.
Yeah.
We know what's best for our families and what we are going through. We want to help make changes, and we want to help retain our families as military families.
Absolutely.
So just consider us. I know we're going over.
No,
so.
it's fine. It's fine. I think that's a great trusting families. And that's something
We're
that I talk
telling-
about a lot.
We're telling so many people exactly what we need, and we're being told, thanks, there's an app coming.
Yep.
Right?
No.
So
Yeah.
Not soon enough.
You just gotta listen. I feel like there's been this long concept that families don't know what's best for them. That they are not capable of making those decisions. And what we know, at least in the military realm, is the spouses are overeducated. We know everything. We run our families. We run
Our local
lives.
community.
We are the unpaid labor that supports the mission. So when we say, well, we need this, we really do need that.
I would say the military spouse the community is shifting from sort of one expectation to saying like, we want to work, we want to be involved, we want to do this, we want to be able to do X, Y, Z. Please don't expect us to just stay home.
Right.
And if we have kids, and just stay home and take care of the kids. It's shifting.
Yeah, it should be
so
a choice.
much, and I think the mentality of the military needs to shift with that.
Yeah, absolutely. All right. Well, we are at time. Thank you.
Thank you.
Yes, go
I
ahead.
can ask you.
No, do the question.
With my
We can
company,
pretend
I'm
like we're
employed
getting
mainly